Today's date is Valentine's Day 2013,
Yes, it is.
and we're here with a lovely woman. Her name is Rachel. And Rachel has come to me for, among other things, we've discovered she's got back pain and some neck problems. And Rachel, let me see you get out of that chair, please. Okay, and I'm going to turn this off. Okay, Rachel, can I have you sit up, please? Stand up. Ooh, you had some problems with that, huh?
Yes, I did.
And sit back down, please.
That's not too bad.
But you sat down very gingerly.
Yeah.
Now, can I have you stand up and walk towards the door, please? All right, and come on back and sit down. And now let me see you turn your head to the right, to the left, as far as you can. Bend it back. And now bend it down. Okay. You can look straight ahead. Rachel, what was it that you said to me earlier that I made a comment?
I think I said I doubt that.
You doubt that with regard to what?
That you would be able to help me with my back problem.
Okay. Because you didn't come in here for a back problem.
No, that wasn't what I came in
right.
for
And the viewer doesn't have to know what you came in here for,
Okay.
but you just happen to have a back problem. I said, well, maybe we can help, and you said,
I doubt it.
I doubt it.
Sorry, I don't mean to
Okay.
distrust you. It's just that usually the C1 treatment usually takes care of it.
Understood. And I'm not promising you that I can help
Okay.
it. But for the viewer, your back pain started after you had some dental work, didn't
Yeah.
it? And it was in tooth number 30, right?
Yeah.
Okay. And how long ago was that tooth removed?
What has it been? 2 weeks ago.
2 weeks ago. So you've been in pain for 2 weeks, correct? In your back. Your back
Well,
pain
it
just
didn't
came
start
on.
right away.
Right.
It started about a week ago. Yeah.
Okay. I'd like to try something with you, if I might.
Okay.
Can I put a little local anesthetic into the area of the tooth?
What kind of anesthetic?
Preservative-free 1% Procaine.
Okay. Is it gonna hurt?
Very little.
Okay.
Very, very little.
Okay.
Okay, thanks. Rachel, I want to see what the range of motion is in your back. Can you bend over and touch your toes, please? Okay, come on up. Was that very hard to do?
Not very
Can you bend
hard,
side
but
to side
I'm not
like
as
this?
I wasn't as flexible as I usually am. This is hard.
You can't go to the
left. I
side.
can't go
All right,
that
and how about the other side?
more. I
A
can
little
go
bit more. It's not
more,
real
but
good.
not total.
How about rotation of your lumbar spine? Let me see you rotate your shoulders to the right.
Rotate my shoulders to the right.
In other words, watch me.
Watch you.
Okay, now rotate your pelvis, please. No, not your pelvis itself, above your pelvis. Not much. And okay, see, you're turning your pelvis when you turn. When I do it, I'm able to keep my pelvis in the same plane and just rotate my whole upper body. That's hard for you to do.
It's hard.
Okay, all right, let's go ahead and do something with your tooth now. Okay, Rachel, we just injected your tooth about 25 seconds ago. Can you get off the table and sit down on that chair, please?
That is easier. That's easier.
Face me. Please stand up.
Yeah, it's easier. Oh my gosh, that's amazing.
Say that again.
That's amazing.
Say it again.
It's amazing.
Now, please go to the door. All right.
It's easier. Walking is easier. How can that be so quickly?
Now, say that again.
How can that be so quickly?
And what is easier, you said?
Walking. Walking is easier.
All right.
Wow. This is called prolotherapy?
No, this is not prolotherapy.
What is
I'll
this?
explain. Please sit down in the chair.
Wow, yeah. Oh my. Oh. was the reason why I came here today, huh?
And once again, please get up. Okay.
Yeah.
What do you have to say at this point?
Okay. I'm a believer.
You're a believer.
Oh, yeah.
Okay.
That's pretty neat.
Larry, may I video you too?
Okay.
Do you have anything to say about what you just saw? Does she look like she's walking easier?
She's walking much easier. She can move quicker.
But-
Yeah, she's had a significant improvement in the last minute and a half.
Okay, there's no doubt in your mind.
No,
Okay, and how long have you been married to her?
well, 5 years.
5 years, so you
Yeah.
would know.
Well, this last week has been a real trial. So
Under-
seeing her move like this is a significant
Oh,
difference.
Thank you. Now, Rachel, I know you must be in a state of shock right now because your back pain is better, is it not? On a scale of 10, you walked in here with 10 points of pain, 0 is no pain. You're a massage therapist, so you know what pain is and you treat people for pain. If 0 is no pain and you came in here with 10 points, how much pain do you have now?
Maybe 1 or 2.
That's what I'm looking for.
Maybe.
What was it? What was it? Maybe. You said maybe, right?
Maybe that it could be that much.
Yeah,
You know.
thanks.
Yeah.
Turn your head to the right, please. Turn your head to the left. Bend your head back as far as you can. Now bend it down. Okay, I would say that's a little
That's
bit better.
even better.
That's even
Yeah.
better too, right?
Yeah.
Well, that's much better. Yes.
Okay, thanks. Now, what was it that you said to me about dealing with your back pain? Do that again.
I said, I doubt that you could help me.
All right, I want to tell you what I just did, okay?
What did you do?
All right. And-
Magic.
Magic, yes.
Magic.
And I said sometimes we see magic here, right?
Yes.
You happened to notice before I injected your tooth, you happened to notice this,
The chart. Yeah.
the chart. Empirical relationship between odontomas and organs and disease. Now, that is a dental chart. And that tells me what organ and meridian and spinal segment each tooth is related to. So when you came in here, I already knew.
You knew
I knew.
what you were going to have to do.
Exactly.
Yeah.
And I knew what the outcome was going to be.
Yeah.
Now, I'm not 100%. In other words, see, your pain started with that tooth. It was dead on, right? And
Oh,
the
yeah.
tooth was extracted and you got really bad at that point. So I knew that that's number 30. That's related to L5S1 area, right where your
wow.
pain is.
Yeah.
Am I doing all right?
Oh, yeah.
Okay, right where your pain is. And I didn't want to put any thoughts in your mind or yours. No suggestion. All I wanted to do was a little test. And just to confirm that that is the problem of your back. So we put the socket to sleep temporarily.
Yeah.
Now hang on, I know you're making a
I'm
face.
afraid.
You're afraid.
I'm afraid it'll come back.
It probably will. It might not. Now I need to explain some more to you. I had, once upon a time, the wife of the Lieutenant Governor of Alaska come to me with a back that was just like yours, only much, much worse. And she was sent to me by a friend of hers for prolotherapy, which is very uncomfortable. A lot of injections, a lot of discomfort. And she didn't have anything on x-ray, and I said, Frances, I don't think it's coming from your back. Do you have any root canals? She said, yes. She didn't know where they were, but I happened to be able to find them with a technique. I injected the first one, it didn't do much. And I injected the second one, and here was a woman who couldn't even raise her leg more than that when she walked in the door. And after I injected the second one, she jumped off the table, did a jig, and said, what did you do to me?
Yeah.
Now, her pain relief lasted for some time, but the pain came back because the local anesthetic wears off and the underlying problem is still there. So I'm going to tell you straight out, I believe there's still a problem in that socket. It's an interference. And I don't believe it was treated sufficiently. I'm not pointing the finger at anybody. I'm not laying blame on anybody. You had a problem with the tooth. There could be dead tissue in there. There could still be infection in there that's causing an interference that's screwing up that meridian, which happens to be the lung, large intestine, meridian system. And the large intestine innervates the L5 area. You with me so far? Okay, so I knew where to go. Your body just gave me basically at least a 90% assurance that that's the problem. There's no 100% in life. Will it come back? It may or may not, but regardless of that, you need attention to that socket because I don't think it was treated sufficiently. Am I making sense?
And what
Okay.
do I do for that?
You need to see a dentist who knows what he's doing,
Okay.
and I'll send you to one.
Okay.
You said?
I said, did you see how easily I got up on this table? I mean, that
Yes,
just wouldn't
I
have
did, I
happened
noticed.
before. That wouldn't have happened.
That wouldn't have happened. Yeah, you
No.
just got right up. Get off the table and down to the chair again. There's no guarding. Go down to
No.
the...
I mean, look at this.
No guarding.
No.
All right, I'm happy at this point. Now we're going to try something else.
It's just, it's not that hard-edged, horrible pain that you just feel like you can't handle it.
Well,
You know, that's gone.
we're about 20 minutes after shooting it, right?
Yeah.
And you
I mean,
said the horrible edge pain is
It's
gone?
gone. It's like, it's just so much easier to move around and get up and down and, oh, thank you.
You're surprised.
I'm totally surprised. Yeah.
Yeah, you were just looking
I
at
just
this
didn't
right here.
I just didn't think that.
And here
that
we
that
see
should be-
lumbar 4 and 5
Yeah.
right here for that tooth.
Yeah.
Can you go ahead and sit down again?
Yeah.
I want to see you sit down. Boy, you're moving pretty spiffy.
Yeah.
Wow. I'm pleased.
Yeah.
Okay.
The pain person is gone and my wife is back.
We like to hear that. Jill, it's been about 40 minutes since I did your tooth. The local anesthetic is probably worn off. How are you feeling?
I feel good. Yeah.
Okay.
Me too.
Back pain's largely gone.
Yeah. Yeah. Very slight now. Very slight.
Okay. May I put this on YouTube?
Yes, you may.
Thank you. May I put you on YouTube?
Yes.
Thank you very much.